Hi, my name is Cindy Barrus, and I'm the program manager for our subacute rehab program that's located here on the Kalamazoo Avenue campus. And once again, we're here for a tour of our new building. This is such an exciting time for us, and I'm really pleased to be able to show today one of our internal courtyards. So right now I'm standing in the doorway that will take us out to the internal courtyard. And as I come over here, you can see that we have a whole covered area here. The first thing that we think about in this space is rehabilitation. And I'm a physical therapist, so what we do in therapy is always think about function and how we can use spaces to help with the rehabilitation journey. So in this space here, even though it doesn't look terribly attractive out there right now, in addition to being a therapist, I am also a gardener. So my imagination goes crazy when I look out here, and I can actually really look out there and see some wonderful space that we'll be able to use for the people that we're serving here. So one aspect when we think about rehabilitation, we need to make sure that we have spaces that people can get outdoors and be in the sun, but also be in the shade. Many times people are on medications and they need to not be out in the direct sunlight, or let's face it, sometimes it's a little bit of a rainy day here in Michigan and we want to be able to get outside but not get all wet. So it's wonderful that we've set up this space so that we have some covered areas and some open areas. And of course, accessibility is a key issue for us. So we have doors that will slide open. This is a safe space, it's all enclosed. So even people that may have some cognitive impairment, say following stroke or brain injury, are able to come out here and have a space that will work well for them. Another piece that I think about from rehabilitation, and frankly I can see it in my imagination right now, I know that sounds funny, but I can look out here and I can see a physical therapist working with our patients on uneven ground, because that's a real functional skill. I can see a recreational therapist working in a garden area with adaptive garden techniques, such as tools for somebody that's maybe got spasticity following stroke, or maybe somebody with arthritis that needs to have a different way to approach a really important leisure thing like gardening or like just being outdoors. Our music therapists every week have musicians here from the Grand Rapids Symphony, and that's through our Music and Health Initiative. How wonderful will it be if we can bring out people and come right out into this courtyard area and enjoy beautiful music, a beautiful space, and be part of the rehabilitation journey. Now, all we need is a glass of wine with that, but that's probably not going to happen. But it does really give us a lot of flexibility for this space. I think another part of what I see out here is just the need to have a place to just be. Rehab is hard work. There's a lot of enjoyment in that because people are working hard to reclaim part of their lives. But sometimes you just need to be able to be with your family and just sit down and enjoy the outdoors. The team that worked on this building from the very beginning was so passionate about making sure that we would have outdoor space that our patients could enjoy, that our residents could enjoy, and a safe spot, and then also some areas around the campus that people can be. So this was something that we fought for. And I can tell you that today is a beautiful day. I can feel the heat, I can feel a breeze right here. So this really adds a very nice piece to our design. The building is set up so that it actually has two wings. I like to say it looks like a cheerleader that's cheering like this. But there's an internal courtyard on the first floor on this arm and one on this arm. So this is one of the two on the main floor that we're looking at here. And I can also see our social workers coming out here and having a chance to just talk with people about their plan of care and their discharge plan and figuring out what's happening next. So we want to thank you for coming back week after week and hearing more about this beautiful building. We are getting very excited about this. Can't wait to be sharing more of this with you in person when we get to our groundbreaking ceremony and our open houses later this summer. Bye.